Welcome back if you were with us yesterday for day one. Welcome if you're joining us for day two. My name is Gina Spicknell-Cook, and I am a consultant out of the East Office, and I'm joined by my colleagues today, and I'll let them introduce themselves.
Hi, I'm Shonda Talene. I am a patent consultant out of the Harrisburg office, and I support school psychology, special education leadership, and behavior. And I am excited. I'm going to be providing you with content today along with Erica, Scott, and Gina.
Good afternoon, Erica Karuder out of the Patent Harrisburg office. I serve on the School Psychology, Behavior, and Mathematics Initiative, and I'm excited to be here for part 2 of Psychological Counseling as a Related Service. So again, we broke this in half to prevent Zoom fatigue. So we're happy for those of you that could join us yesterday and today. If you're just joining us today, welcome. We are posting links to the handouts in the chat right now.
Hi, and good afternoon. My name is Scott Semo. I'm out of our Patent West office. I'm a school psychologist and patent educational consultant on the school psychology, equity, P2G, behavior, and MTSS initiatives. Welcome back.
Thank you. So again, this session is considerations for psychological counseling as a related service. Day 2. This is a 2-part series. Today is part 2 of 2. Our session will run from 12 to 3:15 with a 15-minute break. All participants are muted and the video is off. We are recording this session. Please allow 3 weeks for it to be posted on the Patent YouTube channel's School Psychology playlist. In order to earn credit, please keep the following in mind. Participants must log in individually from a computer or an iPad to the webinar on time, stay the duration of both webinars, and complete an attendance evaluation survey by the designated deadline in order to be eligible for Act 48 professional education clock hours. No credit will be awarded for those who attend by phone audio alone. All of the handouts for yesterday's and today's session can be found on a Padlet. The Padlet will be posted in the chat multiple times today. Our panelists will continue to do that throughout the afternoon. If you have a question, send it to the panelists in the Q&A, please. We have many individuals on this webinar, so using the Q&A will help us be able to respond. Questions are often lost in the chat, so please use the Q&A feature. Time will permit for us to answer those questions. So the mission of Patent Pennsylvania Training and Technical Assistance Network is to support the efforts and initiatives of the Bureau of Special Education and to build the capacity of local education agencies to serve students who receive special education services. Our goal for each child is to ensure the IEP teams begin with the general education setting with the use of supplementary aids and services before considering a more restrictive environment. That's PDE's commitment to the LRE. Our objectives for today's session include reviewing a bit about the legal basis for psychological counseling. If you were with us yesterday, we talked about that. Additionally, we'll talk about the evaluation process, gathering assessment and evaluation data, and then using that assessment and evaluation data to determine the need for counseling services and specific interventions. We'll also talk about progress monitoring and measuring the fidelity of counseling interventions. A little bit of review from day 1. We did talk about how related services are included in an IEP to ensure that a student benefits from their educational programming and are intended to support the student and the parent. IDEA provides for the provision of counseling services, psychological services, and parent counseling and training. We also talked about an umbrella of services and providers, including counseling services, psychological services, social work services, and parent consultation and training. We'll be revisiting that today. Next slide, please. In this slide, we're highlighting the overlap between the National Association of School Psychologists, NASP, and the Psych Counseling as Related Service, PCRS, and we share it now as a refresher. Part of today's discussion will encompass the evaluation process, administering the tests and other assessment procedures, interpreting the results, integrating those results, and consultation around the assessments used and the results. Positive behavior interventions, plan development, and counseling will also be discussed. I'm going to turn it over to Shonda to talk about the evaluation process.
Thank you so much, Gina. And before we get into the evaluation process, we did want to take a moment to orient you to the Padlet. And you do have the link to the Padlet in the chat. So I am going to just go out to the Padlet. So if you click on that link, it will take you to this Padlet, and you will always have access to it. And we will be adding resources to the Padlet as appropriate. So in the first column, you can access the PowerPoint and handouts. We are referring to the patent publication for PCRS. So if you want to share some of the information that you learned today, you can share this patent publication with your teams or with your special ed directors. So this is our patent publication for psychological counseling as a related service. And you can also access the slides for today. And I do believe that once the recordings are complete, they will be added to the Padlet. And Erica, you can put in the chat. Is that correct, Erica?
Yes, we are working on it. It takes us a little bit to get those edited. Once they're edited and fully captioned, then they will be on our patent YouTube page. And I'm going to add a column to the Padlet so that I can embed those links in there as well. So you can find it all in one location.
Nice, thank you, Erica. So also you'll see that there are columns for the various topics we'll be discussing today. So progress monitoring, consideration for telehealth, equity resources, data to help teams advocate for an expanded role for school psychologists, information on mental health and well-being for students, families, and educators, some more information on the National Center for Intensive Intervention. We'll be sharing some of their resources today. And then some of the information that Ronnie Russell was talking about with Medicaid billing would be available through the Department of Health and Human Services document that she had added to the Padlet. And like Erica said, we will add a column once we have the recordings available for you for the 2 days. So I'm gonna start to share again, and we're gonna start to talk about the evaluation process. So if you remember yesterday, when we're thinking about determining need for psychological counseling as a related service, we want to begin by thinking about our assessment process and how we're evaluating students' needs. So we are gathering assessment data in order to determine the need for counseling services and also to identify the needs areas to target with the counseling intervention. So we're going to spend the next bulk of time really talking about what data might be included. A child must be assessed in all areas related to his or her suspected disability. The evaluation must be sufficiently comprehensive to identify all of the child's special education and related service needs, whether or not those are commonly linked to the disability category in which he or she has been classified. So IDEA mandates that related to evaluations that we identify related services. Our assessment data are the basis for determining the need for counseling services. IEP teams make their decisions regarding the need for counseling as a related service based on the unique needs of the individual student. And it's good that we remember that determination is not based on the student's particular eligibility category. So a student who might be identified as having a learning disability or other health impairment, they can still have psychological counseling as a related service. It is not based on their particular eligibility category. A student with any type of disability may be considered for counseling as related to service of if the IEP team determines such support is needed to facilitate academic, social or interpersonal, emotional, behavioral progress, and for the student to benefit from special education. So that's kind of our parameters when we're thinking about determining need for students. So we're going to be utilizing this continuum as we're considering assessment considerations. So first of all, what are we trying to answer as we are gathering data? Okay, so there are 3 questions we can keep in mind. So where's the student presently? We can answer that question through the collection of data in all relevant areas in order to have a clear understanding of student needs. Where is the student going is another question to consider. This includes consideration of grade level and behavioral expectations and standards. So how are we going to determine where the student should be going? How can we create goals for that student? And then finally, how does the student get there? So what strategies might we employ as an IEP team in order to assist the student in meeting their individual goals? So that's where we might think of SDIs, and that's when we think of the need for related services, including PCRS. So is PCRS needed or required in order for the student to get where they need to go? Okay. So if we're determining what to assess for students, we want to make sure we're assessing strengths. So we can assess for quality of life indicators, such as strengths across those various life domains. For example, academics, health, career for our older students, and social. So we want to think about the strengths that the student and family are bringing to the table. We also want to, of course, identify needs. So these could be behavioral needs. We always want to consider academic needs because we want to understand what might be preventing the students from being successful within their school setting. We want to make sure we're always including those academic needs, as well as social emotional needs, and also considering communication needs. Next, we want to consider the stakeholders. So consider the various stakeholders and the information that they may be able to provide to answer the questions of where is the student presently, where is the student going, and how does the student get there? So of course, we want to include the student if it's age appropriate, parents or family members or guardians that are associated with the student, teachers, additional caregivers, if you have permission to speak to those persons, school counselor, if they've been working with the student, the school nurse is a good source of information as well. If you are attempting to gather information from community providers or outside support agencies, we always want to make sure that we have releases to be allowed to talk to that individual or those agencies about the student. Once we've thought about possible stakeholders, possible persons to receive information from, we also want to consider appropriate assessment tools. So during both initial and reevaluation, comprehensive assessments are conducted that include record review, behavior rating scales, direct observations, interviews, and completion of a functional behavior assessment. And we're going to talk about each one of these individually. Each of these assessment methods represent accepted practice and are completed across settings and with various respondents. Examples of potential settings and respondents could include the classroom setting, school, home, and community, and gathering data from the student, parent, or caregiver, teacher, school nurse, etc. It's important to conduct a thorough record review in the early stages of the assessment process. Record reviews can include cumulative educational records, which contain valuable background information about the student's personal characteristics, skills, strengths, and weaknesses, behavior history, and history of services, including pre-referral interventions and their progress on those. Additional information regarding a student's social, medical attendance, and academic histories can provide insight into possible motivational triggers or antecedent stimuli and events that may increase the likelihood of interfering behavior. Disciplinary history may chart the progression of interfering behavior, provide clues about potential antecedents and consequences, and offer information about effective and ineffective disciplinary strategies. Previous evaluations can provide information about skill delays or deficits, and FBA reports may reveal historical antecedents and consequences, as well as any potential changes in function over time. Similarly, previous intervention reports and progress monitoring data can identify interventions that have either been successful or unsuccessful. Finally, current and previous IEPs reveal skills deficits and the degree to which interfering behaviors are being addressed and monitored within the school setting. We also included nurse visits and nursing records as a possible resource because nurses are great people to talk to regarding students who may have more internalized behaviors. Being aware of the frequency of nurse visits and somatic complaints and all will help us understand the context for many of these students. So once we complete a record review, we might next start to think about the possibility of utilizing behavior rating scales. Behavior rating scales can be used to gather information that may suggest underlying personal characteristics or skills deficits that contribute to the occurrence of interfering behaviors. Students, teachers, and caregivers complete rating scales as part of the diagnostic process to determine whether a student is exhibiting a clinical level of symptoms associated with particular syndromes or disorders. So these are typically omnibus scales. So they often provide a comprehensive profile of a student's behavioral functioning. So if you think of something like the BASC, that would be an example of an omnibus scale because it is sampling various behaviors, whether adaptive behaviors or maladaptive behaviors within the BASC. Once you've completed an omnibus scale, you might determine that additional rating scales that are designed to measure more specific adaptive or social skills can also be administered to gather additional information about a student's unique strengths and weaknesses to help facilitate understanding of why some situations are particularly challenging and more likely to trigger the interfering behavior. So you might administer the BASC initially, and perhaps you're seeing that the student is scoring at a clinically significant level in the area of attention. So as a follow-up, you might then determine that you want to also have teachers or family caregivers complete the Connors rating scale because that is more specific to attentional difficulties. So we just see that we're utilizing this process to help us continuously uncover and pinpoint the needs of the student. There are some considerations when you're thinking about behavior rating scales. So we want to always consider the psychometric properties of the rating scales. So you always want to look at the manual that's associated with the behavior scale. So if you have a behavior scale and you don't also have the manual that goes with it, you definitely want to do some research on that and make sure that it is adequate. So you want to look at validity scores, you want to look at reliability, you want to consider construct validity. Is the scale measuring what it purports to measure? And often those manuals also talk about research around rating scales. So you want to always look at the psychometric properties of the rating scales that you utilize with students. You also want to consider rater variance. So looking at how raters are responding on the scales, is there a possibility of response bias? So if you see that most of your answers from a respondent are the midpoint, or are all of your, or most of the responses at the far ends where they are, have the student being significantly high in every area or significantly low in every area. So you want to consider the rater variance and how they're responding to scales. You also want to consider the setting. So if you have multiple raters, you want to consider how does the responses vary related to the context that the rater sees the student is. So a home or community rating might be different than a school rating. And even within school, ratings by a general education teacher might be different than a rating by their special education teacher. So consider variability based on the context. You also want to consider temporal variance. So because we know behavior changes over time. So does the time period in which the behavior rating scale make a difference in how raters responded to items? And then also think about instrument variance. So you can consider if rating scales are purporting to measure a certain a certain construct, but are you getting different results? So you want to consider all of those things because rating scales are useful, but they're not perfect tools. So keep the listed limitations in mind. And do understand that response bias can be even greater when considering internalizing behaviors versus externalizing behaviors. And you always want to verify the results of behavior rating scales with additional data, such as looking at record reviews, interviewing, observations, etc. So speaking of interviews, so you can create or you can conduct semi-structured interviews with various stakeholders, including parents, caregivers, teachers, and the student when appropriate. So interviews can be beneficial to conduct after the completion of some of those standardized rating scales in order to gather additional information about the behavior of concern. And these interviews become even more important if you have some concerns about the responses on those rating scales. So it can help you confirm the results. The interview can be focused on areas of concern identified by rating scales and can provide additional information in these interviews so that we can increase the engagement of families and teachers in the evaluation process, because we want to hear their experiences with the student and we want to hear their points of view as well. And it can also help and assist in establishing the context of the student's behavior and identifying specific targets for possible counseling services. So structured interviews are typically recommended to ensure that the information obtained is specific to the nature of the assessment process. So you may consider conducting interviews with the student, guardian or caregiver, teacher, and others. And various structured interview measures are available to describe the nature of the student's behavior, social communication, social interactions, and overall student strengths. So interviews used in conjunction with behavior checklists and direct observations may be used to support the need for psychological counseling. So when you're thinking about some of the family factors that you might touch upon in your interviews, it could be changes in family structure, considering changes at home. Is the student moving? Is there home insecurity at play? Has the student recently changed schools, or what's their history of schooling? You can also ask questions regarding psychological problems of other family members or services that family members might be receiving. You ask questions about younger or older siblings. You can ask questions about the history of the child experiencing significant loss to have more understanding about the possibility of traumatic experiences, and is the student responding to traumatic experiences within the school setting. You can also gather more information about past hospitalizations or illnesses of the child or family members. And And finally, you can also ask questions regarding alcohol and drug abuse and utilize this information to help gather a more complex and complete picture of the student. So we've talked about record review. We've talked about utilizing behavior rating scales, and we've talked about interviews. So let's talk about doing those direct observations. So during interviews, we can develop working definitions of the target behavior. Direct observation of those behaviors, though, typically leads to a more refined operational definition. Operational definitions describe the target behaviors clearly and objectively in order to facilitate consistent and accurate measurement. And that's important as we are developing goals, as we're developing behavior plans, as we are collecting additional data and completing that FBA process. Having an operational definition of the target behavior is important when it comes to collection of observation data, because we want to make sure that we are understanding what it is we're observing. There are several methods of recording direct observation data, and the selection of the observation method should be driven by several factors. So consider the topography and the measurable dimensions of the behavior. The measurement procedure should be selected with consideration of the observable features of the target behavior. For example, if it's a behavior that occurs rapidly and often, utilizing a frequency count may be a better measure observation method instead of doing a measure of, say, duration or latency. So with the frequency count, you might be doing tally marks every time the behavior occurs. So we also want to consider the reason for referral or the goals of an intervention. So the measure should capture the dimension of the behavior that is problematic and will be targeted for change. So for example, if the concern is how long it takes a student to comply with directions, then measuring latency might be the most appropriate method. So in this example, a teacher or an adult might give the student a direction, and then latency would be determining how long does the student spend between receiving the direction and following the direction. So that would be a measure of latency. And so if that is what the concern is, the student's non-compliant behavior and the length of time, latency would be the best observation method in that example. You also want to consider pragmatic considerations. So you want to consider things about availability of time, resources that are available, including persons and their skill level. So what is the skill level of the observer? Should be taken into account when you're selecting your observation method. You also want to make sure that you are observing in multiple settings and that it can be connected to the FBA that you are conducting. So now we're going to talk about functional behavior assessment, and Dr. Hunter talked about FBA a little bit yesterday, and we're going to talk about it some more today in a little more depth. So just remembering that FBA is a process for understanding the variables that contribute to the occurrence of the interfering behavior. So we are going to spend some time discussing antecedents, contextual variables, individual behavior skills deficits, motivating operations, discriminative stimuli, and maintaining consequences. An FBA includes data collection, and we've talked about various data collection methods. So the data that you gather through your record review, through your behavior rating scales, through your interviews, and through your observations are all part of the FBA process, okay? So an FBA includes data collection to determine antecedents. So that's what's happening before the target behavior or before the behavior of concern, and consequences, or what's happening following the problem behavior over a specified period of time. So hypotheses are developed based upon the collected data, to determine the function of behavior. So assessment of the function of behavior aids in the development of positive behavior support plans, which outline interventions and strategies to reduce the targeted behavior. So thinking about those requirements of an FBA, we always want to have that identification and that operational definition of the problem behavior. And remember, you can get to that operational definition through behavior rating scales and interviewing those stakeholders to get a more specific understanding of the behavior of concern. We're recording interfering behaviors, and that's when we're thinking about those methods of observation. Also with record reviews, that can help us with recording of interfering behaviors. We're utilizing all of these data in order to identify antecedents and consequences and to develop a hypothesis about the function of the behavior. So this is an 8-term conceptual model. So hopefully this is something that you are familiar with, that you've seen a model similar to this. Often it's called the competing pathways model. So this is an example of an 8-term conceptual model, and it's been expanded from previous models that you might have been exposed to or learned about when you were in school. So by distinguishing between motivational and discriminative antecedent influences on behavior. So discriminative stimuli are antecedent stimuli. So this is what's happening before the interfering behavior. So if you look over here, this is where we're referring to within this model. So prior to the behavior. Discriminative stimuli are antecedent stimuli that are correlated with the availability of reinforcement and set the stage for the behavior. It signals the availability of reinforcement triggers, reinforcement that triggers interfering behavior. Potential sources of reinforcement could include the presence of reinforcing items and people associated with the delivery of reinforcement for interfering behaviors. The model also includes motivating operations, individual variable responses, or interfering behaviors and consequences. So motivating operations, and you see those up here. Motivating operations are conceptualized as overarching variables that make discriminative stimuli more relevant. So individual variables more significant and interfering behaviors more probable, and reinforcing consequences more valuable. So if you think of things like emotional arousal, thoughts and images, these are all part of motivating operations. When we think about context as an individual variable, so context refers to the setting or the environment in which the interfering behavior occurs and can include a physical location. It can include social circumstances or types of activities. Personal characteristics includes the student's individual traits, sensitivities, beliefs, and values that contribute to interfering behavior. And this can also include those quality of life indicators such as student strengths and interests. Skill delays and deficits refer to the appropriate behaviors that are either absent or limited that can impact the student's ability to cope and respond successfully within specific contexts. So things such as communication, academic skills, adaptive living, social self-management skills can all contribute to an interfering behavior when they are limited or absent. So we've discussed motivational triggers, sources of reinforcement, interfering behaviors, and reinforcing consequences, but also think about parameters of reinforcement. So this is what's happening after the behavior has occurred. So parameters of reinforcement are the dimensions of reinforcement that influence its effects. So how effective is the reinforcement? So the parameters include a schedule. So how frequently is the reinforcement delivered contingent on the interfering behavior? So if the student is reinforced every time, and this could be inadvertent reinforcement, not intentional reinforcement. So if a student's interfering behavior is reinforced every time the student engages in it, it's going to make them more likely to continue to choose to engage in that interfering behavior. We also consider the quality. So how valuable or preferred is the reinforcing consequence for that student? We can also consider the magnitude, or how large is the reinforcer or length of access to the reinforcer after the student engages in the interfering behavior. And then also timing. So the timing is how immediate or delayed is the delivery of the reinforcing consequence. So just understand that when we're talking about reinforcers or consequences, that's what's happening after the behavior occurs. And these can be unintentional reinforcers, and we understand that something is reinforcing if the behavior in the future continues or increases. That is showing us that that behavior is being reinforced. So as we're conducting our FBAs, we are attempting to identify the antecedents. So we're looking at these individual variables such as context, personal characteristics, identifications of skill delays and deficits. So consider how your various assessment tools are helping you to identify those. We're also going to consider motivating operational, such as students' emotional arousal, thoughts, visual images, etc., that might also be attributing to the student's choice to engage in interfering behavior. In terms of the interfering behavior, we're going to specifically operationally define that so we understand what it looks like, what it sounds like. And then finally, we're going to utilize our data to identify what has been the consequence to that behavior and considering the parameters of reinforcement. So we're utilizing all of the data that we've gathered, and we are going to put it into this 8-term conceptual model to complete an FBA in order to develop a hypothesis that will lead us to the development of positive behavior support plans and also help answer the question regarding is psychological counseling required as a related service. So something else to think about, often we think about externalizers when we're considering FBAs, but we also need to consider students who might have more internalizing behaviors. So when we're thinking about internalizing behaviors and applying functional behavioral assessment techniques, we can think of operationally defining a student's affective states. Okay, so maybe not an externalizing behavior that we're operationally defining, but instead an affective state. Thoughts such as excessive worrying, recurrent thoughts about traumatic events, or negative self-talk may elicit emotions, and those emotions in turn can alter the value of reinforcing consequences and the probability of behavior. So considering affective states, thoughts, emotional and internal states and their contribution to occurrences of interfering behaviors can assist in the development of a positive behavior support plan and help support the identification of the need of PCRS. Additionally, school psychologists can consider trauma when assessing students. So in a trauma-informed model of healthcare, the assessment of the ABCs, and we just talked about that, the antecedents, interfering behavior, and consequences, can be followed by an evaluation of what they call the DEFs. So D standing for distress, E for considering emotional support, and F considering family factors. So in school psychology, we assess our own ABCs. Incorporating the DEFs is a highly useful complement in our assessment practices. So assessing distress refers to gathering information about the child's fears and worries related to the assessment process, the child's experience of grief and loss, and how that trauma may be impacting their academic, behavioral, and/or psychosocial functioning. We can also assess the second two parts of the DEFs can be conducted in context of engaging in consultation with parents. Partnerships with parents and families is an essential component of providing trauma-informed care. The E and DEFs represents emotional support. Assessing emotional support for a child involves understanding what supports the child needs to cope and barriers to accessing those supports. So assessing emotional supports involves, once again, consulting with families to understand what successful coping strategies have been used or are used at home, ensuring that parents have understanding about the reason for assessments and possible methods of intervention. You can also ask parents to contribute to the evaluation, and we talked about that through the use of interviews, through the use of completion of behavior rating scales, and also encourage parents to utilize some of those successful coping strategies that might have been used in the school and the home setting as well. The last part to evaluating the DEFs involves examining those family resources and stressors. And this fits well within that consultation model that we talked about a little bit yesterday with Dr. Hunter. So when school psychologists or other individuals are gathering information about family resources and stressors, they can encourage parents and siblings to access additional resources that may be needed, such as outside mental health supports, which may lead to a more stable and supportive environment for the student and family as a whole. So we've talked about the evaluation process. We've talked about considering tools. We've talked about the FBA. Now we're going to talk about some guiding areas for consideration as you're planning to conduct the evaluation. So we want to make sure that we are utilizing a multidisciplinary approach, meaning that we're involving multiple people over multiple days, and we're utilizing multiple tools. We don't want to base our assessment solely on one tool or one method, because remember, we want a complete view of the student. And we want to make sure that we are conducting the assessment over multiple days, because just like we said, behavior is temporal. It can change based on the day. And if the more days that we are utilizing for our evaluation, especially observation, that's going to help us be more specific with our antecedent and our consequences when we are completing the FBA. We want to determine any time constraints the student or evaluator may have when completing the assessment. We understand time constraints, especially now. If a student has absences, if teachers have absences, considering the way that our schedules are changing on a day-by-day basis because of the pandemic, we want to make sure that we're being very intentional as we're planning our evaluations. We want to ensure that the assessment occurs in relevant environments. So if you have done interviews with stakeholders and you understand that the behavior is happening most often in math, we want to make sure that we're doing observation and gathering data from that context, and that we're not skipping that. We want to be familiar with the assessment instrument and have the right materials on hand. So remember when we talked about understanding the psychometric principles, understanding limitations of tools, and making sure that we have the skills to administer the tools that we choose to use. We want to recognize and honor the students' cultural and linguistic differences as we are both assessing the student and interpreting results. We want to make sure that we're building rapport and ensuring that the student has an effective way to communicate their responses, as well as family members and caregivers. And we want to provide the student with any needed accommodations or assistive technologies that may be required in order for them to fully participate in the evaluation process. So we've talked about planning the evaluation. You've conducted the evaluation. Now we're going to start the process of reviewing assessment results. This is a part that I always enjoyed as a school psychologist. If you are someone who, likes to be the detective or likes to be the scientist, this is your opportunity when you're getting all of that data together. So you're going to gather and organize your data, review your data, and then begin to interpret that data and thinking about how your data answers the questions that you have posed. Thinking about those 3 questions that we talked about earlier. So students' strengths, students' needs, understanding interests and preferences. You're going to be looking for similarities and differences, as well as identifying patterns. So how did the data that you collected relate to the students' long-term goals and help you understand what the students need in order to reach those goals? And finally, you're going to summarize those data and then make recommendations. So where does assessment data go on the IEP? So no matter how your assessment data are obtained, whether formal, informal, observational data, team-based data, we're going to interpret that data within the present levels section of the IEP. And we also want to make sure that we include baseline data. And we also want to make sure we're including that parent and student information is also being considered when we are developing those present levels as part of the IEP. So here are some things to consider when determining the need for counseling as a related service. So the IEP team is going to review that evaluation report as well as present levels of functional performance. The focus should be on school-related issues. So while the student might be having separate issues in the home or community setting, the purpose, for our purpose, we are focused on school-related issues. So we are going to consider whether or not the services are necessary for the student to make educational progress, okay? And then assessment data should, in our conversation, should be centered on the data. So our assessment data should help to identify specific targets for intervention. And then we're going to also consider when we're thinking about counseling and the student's ability to benefit from counseling, we want to consider the intellectual level of the student as well as their language development, okay? So we are going to consider all of those facets to make that team decision on if the student needs psychological counseling as a related service. Just like when we're considering occupational therapy as a related service, physical therapy as a related service, it's a team issue, and we are looking at it in the terms of school-related issues, and is it needed in order for the student to make educational progress, and those decisions should be determined based on data. Okay. Going along with determining the need for related services and documentation, after you've reviewed all relevant information as that IEP team, you may have determined that the student is indeed in need of related services, and that related services psychological counseling. So your IEP must specify for the related service when the service will begin, how often it will be provided, and for what amount of time, and where it will be provided. Patent has various resources that are available to you when it comes to appropriate documentation on the IEP. I would recommend our annotated IEP as a resource to assist in understanding how to document related services appropriately. And you can find the annotated IEP on our patent website. And if we could even possibly put the link to that in the chat or add that to the Padlet as well. So I'm going to turn it over to my colleague. Gina is going to now talk about, we've determined the need for psychological counseling. So we're going to do that next step and consider psychological counseling services. And I see Erica. Does that mean that there's questions?
Questions?
Yes, I was
Questions.
Yes,
Okay.
I was just going to pop in. There were a couple great questions in the chat. I think the one question Gina will be addressing here in her section, wondering what a school psych's role may or may not be for regular ed students that are showing a need for counseling. Are students only eligible for psych counseling if they have an IEP? And I think that in the context of this session, we're talking about Chapter 14 services, psychological counseling as a related service. But when we think about multi-tiered systems of supports outside of special education or meshed with special education, that may be a little bit different. Gina's going to talk about the roles of different professionals. And another question in the chat, when a parent or teacher requests psychological counseling as a related service for their student, this would then initiate the need for an ER or RR question.
You're asking that question. So yes. So if you're adding a related service, you would of course need to base that related service on data. So we would need to gather data in order to be able to make an informed decision whether or not the student does indeed require psychological counseling as related service. So we would go through the process of either if the student already has services, it would be an RR. And if it was part of an initial evaluation, hopefully that's something that would have come up when we are planning the evaluation. So definitely we would be gathering data, we'd be going through this evaluation process, we would be writing a reevaluation report and having an IEP team meeting to review those data and make an IEP team decision to determine if psychological counseling is indeed required as related service.
Yes, and we had a similar question earlier. We did have a question. Are there any samples you can offer regarding
Operationally defined behaviors.
Affective states?
Oh, affective states.
Yes.
So if you are thinking about operationally defining affective states, so so perhaps the teacher might say the student, and Erica and the fellow psychologist jump on, if the teacher is saying the student worries all the time, so we would want to talk about what is your evidence that the student is worrying. So what are the indicators that the student is worrying in your class? So then the teacher might further say, well, when she worries, she wrings her hands, she stares out into the window. There's a delay there's a delay between me asking her to complete a task and her ability to start the task. So you're really just always prompting, if you're getting a vague description, what does that look like? What does that sound like? And Erica, I mean, that's what I would always do, because typically we do start with something that's broad and vague. And as the person who's interviewing, you just want to keep digging until you get to the point that it is something that you can, any person could walk in and understand what the teacher or the adult is describing.
Yes. Yes. What does it look like? What does it sound like? If I walk in that room, how will I know this is happening? Another thing, sometimes it can be a little bit difficult. I would just add, if there's a way to maybe get some student report on the person, and specifically to some type of stimulus, because that can be helpful information as well when we think about comprehensive, we think about comprehensive information gathering for the assessment processes you were just describing.
Yeah.
Okay, great. And okay, answer live. Can you define, clarify school-related issues? So I think this, or give examples. So I think what this is referring to is when we think about psychological counseling as a related service, it is to target issues that are interfering with students' school performance, and there's a need for it. So do you have some particular examples?
So you can think about school-related issues. It could be issues with peer relations. It could be if a student is unable to participate academically within their classroom because of psychological factors, so work completions, even entering the classroom, making transitions, being able to communicate and collaborate with peers. Being able, anything that is going to prevent the student from engaging in academic instruction or showing similar behaviors that are age developmentally appropriate in comparison with peers, anything that is preventing the student from doing that, those would be considered school-related issues.
Awesome, thank you. A few more are popping in. I think we talked a little bit about this one yesterday, so team, feel free to jump in. Do we need to consider if a student is already receiving outside counseling services? Could consulting with a school psychologist potentially interfere with an established treatment plan between a student and their outside counselor?
So as a psychologist who practiced, and if I ever knew that a student was receiving outside counseling services, the first thing I would do is get a release of information so that we can bring that counselor on board as a member of our team as much as possible. And I would often ask for that person's treatment plan so that we could assist in generalizing within our setting. And it might be that we are working in conjunction with that provider to consider school-related issues and how can the skills that they are working on within that setting, how can we support the student with generalizing within our setting. So if you think about it this way, if a student is receiving outside tutoring, does that mean we're not going to provide academic support in school? Is that going to derail the other? So think of it that way.
Yeah, great perspective. Had a little bit more, maybe some expansion on motivating operations and how they fit into the FBA. And a little bit more specific, this person is thinking of students who may have shutdown behaviors and they're reluctant or maybe unable to indicate what is going on for them.
So that might be more thinking, so you are thinking about the emotional state of the student. And that's where you're considering really thinking about those antecedents, those contextual things that might be contributing to the students shutting down. So it could be their emotional states, thoughts that they might be having. They also talk about these visual triggers that might be triggering the student shutting down. So you might have to do additional digging and think about what we talked about when we talked about FBAs for internalizers, and really thinking about the umbrella of how the emotional state of the student is affecting the antecedents and making engaging in interfering behavior more likely, thinking about the reinforcers for that interfering behavior and how the emotional state and those antecedents can make the student need that reinforcement more. And remember, when we're talking about reinforcement, it's really those consequences, those things that are happening after the behavior occurs, whether intentionally or unintentionally reinforcing the interfering behavior.
Yeah, and I will just add to that, one of the things, the shutting down behaviors, as we think about, especially whenever a function is to escape tasks. I'll talk a little bit about academic progress monitoring, but having that right instructional match is so critical. And so that may be another aspect, especially when the function is avoiding tasks, and that may be a trigger for shutdown behaviors.
Mhm.
Okay, done.
And just really quickly, one more thing, and I will put a link to this. There is a book by Mark Steege, Steege, Conducting School-Based Functional Behavioral Assessments, 3rd edition, and he talks in depth about the 8-term contingency model for FBAs and motivating operations. So we can also add this to the Padlet. It's an excellent resource and really goes in depth about completing FBAs within the school setting.
All right, awesome. I think we'll go ahead and turn it over. Yes, we will add that resource to the Padlet, the Steege book, and we're going to go ahead and turn it over to Scott and Gina.
Thank you, Shonda. Thank you, Erica. So and some of the questions that were left unanswered in the Q&A will be touched on a bit in this section. So we can always circle back to those if needed, okay? So now we're to the point where the IEP team has determined the need for psychological counseling, and there'll be discussion about who will deliver the service. So how are these services delivered at your school? And are there other ways to utilize the professional experience in your setting? There are some considerations about who will deliver the services. So for example, the role and availability of the person. Is it the school social worker, the school psychologist, the school counselor? Also, the level of expertise is a consideration. What is the person's comfort with the intervention or program that will be used? How does that match the need of the student? The intensity of the student need is another consideration. So what would the frequency and duration of the services that will be needed? So those are all things that we'll be thinking about as a team as we're deciding how to meet the need and how to deliver the psychological counseling as a service. Psychological counseling services, is a continuum, and it's more broad than the term may suggest. The type of service needed will be determined by the IEP team using the assessment data. And Shonda gave us a really extensive explanation of all the assessment data that could help us determine the need and how it will be delivered. Another example would be for replacement behaviors for positives, like a positive behavior support plan. That actually falls under this continuum of services. And when the team or the professional is determining the replacement behaviors for the support plan, it could be coping skills or other strategies that would be taught within the counseling. Next slide, please. I probably could mention there too that when writing the IEP, and I saw this in the questions, we would consider, is it SDI versus goals? Is it more intensive and individualized? Then it would be a goal in the IEP and not just specially designed instruction. The goal can help focus the counseling interventions. So this slide, kind of shows what are the ways that we're thinking about documenting this service. And I know that that was a question about whether it's SDI or whether it's a goal. So I'm sorry, I did want to say one more thing. After the IEP determines the type of support needed, and I apologize. After we determine the type of support, we need to talk about how to document it. And sometimes, again, we're not thinking as broadly. Many of the things such as classroom management plans or behavior support plans, they go in the SDI. And that is still part of this umbrella of services that we're talking about. So consultation would be more in the related services and supports for school personnel section. So for SDI, we could be thinking about the behavior plans. For the section that supports school personnel, that would be consultation, regardless of who's providing that consultation. And then group and individual counseling, that would be in the goals and objectives. Now, onto the possible roles. Thank you, Shonda. Okay, so the possible roles. Again, when we were talking yesterday, we talked a lot about how this is an umbrella of services and different people providing them. And so the next couple slides talk about, what are the possible roles for the people delivering the services that we've identified. So some of the specific feedback we used to develop this presentation was the difference between the role of the emotional support teacher, school counselor, and school psychologist. And that's what had us thinking about this and thinking about what are the possible roles. And based on the continuum of services that fall under the umbrella of psychological counseling as a related service, you can see that there are potential non-overlapping roles for all of the professionals that we've been talking about. Classroom management plans, positive behavior support plans, basic social skills groups, social skills lessons, morning meetings, those kind of things could be delivered by the emotional support teacher and often are. Next slide, please. So possible roles for the school counselors and the school social workers. When we consider the role of the school counselors and social workers, we think of them as providing the actual counseling interventions. They also can have a role in consultation. And I just want to say here, almost like a shout out to social workers and mental health workers that I've worked with, that I've learned some of my most valuable group facilitation skills when co-facilitating with the social workers in my program. So that's another thing to think about, who will be providing the service and who has the expertise in that area. Next slide, please. The role of the school psychologist. We talked about this a bit the other day when we talked about how psychological services are outlined in IDEA. And we talked about how to expand the school psychologist role to include some of these services, because school psychologists do, like their colleagues, school counselors and social workers, have training in these areas. The possible roles for school psychologists would include individual counseling, group counseling, parent counseling, and that would be under Pillar 5. If you think back to yesterday when we were talking about the pillars of psychological services. Another role for school psychs is Pillar 4, consultation, and that would be interpreting data and assessments, as well as developing behavior support plans, which also encompasses Pillar 6. Do we have any other questions before we take a break? We did have breaks scheduled.
Just check here. I think got that one. You've got that live. People asked, are people using HIPAA compliant release forms? I guess that's a good question for the field. I am hoping that if you are collaborating with agencies that are that need to adhere with HIPAA guidelines, then I'm hoping that you would be using release forms that are HIPAA compliant. Otherwise, they probably wouldn't collaborate or accept the release forms.
Erica, I could say something about that just as a note of, I've seen it done a couple different ways. And in my previous setting, it was a center-based emotional support program with a partial. And so we had to do 2 release forms, a HIPAA compliant form, and also the special education consent to release information form. So, we definitely need to be aware of the medical records that were being shared or possibly being shared with the outpatient services that existed in our IU, and also with the students that were in the partial. So I just wanted to mention that.
Yes, awesome. Thank you. And then just one more question and then we'll take our break. Do you have recommendations for when counseling and a goal might be appropriate when an SDI meets the needs?
Eric, I could probably shed a little light maybe on that information.
Okay. Awesome.
I was trying to think back, there's a lot of really good discussion we've had today with regards to the presentation, but as well as, what we're seeing in the chat box. I remember over about 26 years of my career, the most difficult thing I found over time was, when does a kid qualify for psychological counseling on an IEP? And then once you figure that they do, how do you translate that from an educational model, from a mental health model that you receive from outside sources to an educational model for a level of understanding on what's your role then in that process. I would often look at it, as we talked about, as a continuum of services, where in the MTSS structure of a school system or a community-based school, or an outreach, even residential treatment programs, oftentimes if we think of things as tier one, there are going to be a number of interventions that are more beneficial that'll take place across the large, broad spectrum of the overall program. And then there are some, oftentimes there's anxiety groups that are run at a tier two level of support within an MTSS framework. What I would try to do, I remember back, is I would say, okay, I'm working with a student, that student has depression. Okay, as a school psychologist, I have an understanding what depression is. However, I'm based in an educational model, not a mental health model. So I'm not going to be providing psychotherapy. But what I have to do is I isolate the symptoms and the behaviors associated with that particular student and able to decrease that anxiety and have them have more self-management and self-awareness to be able to engage in the curriculum a lot better. Not treating the depression, but looking at instructional strategies to put in place to have that kid be able to, one, relax, and then two, engage in the academic process. So that's how I kind of saw my role in the educational form of psychological counseling as a related service. Then what I did was I went and I pulled something from years ago that I remember then, okay, so let's say we do an evaluation, we have assigned permission, and we say this kid's going to receive psychological counseling as a related service. The most difficult things, I think, for social workers, school counselors, school psychologists is taking that information and then putting that into an IEP. Because I don't know about you, but until, as a school psychologist myself, until I started to participate and provide psychological counseling as a related service, I wasn't the expert in writing the goals or the specially designed instruction. So I would basically always kind of start with the present level of functional performance, and I would say something like, really, we're going to work on the skills associated with self-awareness and self-management to achieve school and life success. And this is, I'm just taking this from an example, by identifying, monitoring, and managing one's anxiety, self-control, emotions, behavior. And then you always want to recognize positive qualities in kids. You always want to look at strategies that they have an understanding of that they can bring to the table to help assist them, and then whatever external supports they had. Then I would turn some of that information into a goal after I did an evaluation and I got the strengths, the needs, and everything that Dr. Talene had told us about. Then I would create that major annual goal for that student. But in that, I would say, something like, given a real life interaction, event or request, Bob would independently review and assess his thoughts by applying 3 rational questions. Is my response based in thinking and fact? Does my response in thinking help me achieve my goal? Does my response in thinking help me feel the way I want to feel? So now I'm taking everything that that kid might experience in the form of depression, but I'm putting it into an educational context. Then I would look at the PA state standards for self-awareness and self-management. I'd put them in the IEP. Then under the part, how does the student progress towards meeting this goal will be measured? Well, you can use data collection, observation, performance, evidence-based intervention activities, daily behavioral sheets. So there you go. There's some good ways to collect data. What periodic reports on progress will be provided to the parents every 9 weeks? Now here goes some specially designed instruction I remember using that I think is kind of palatable and people would have an understanding of. Naturally, collaborative problem solving methodologies, cognitive behavioral therapy approaches, right? Summarization, open-ended questioning, reflective listening, contingent management, rehearsal role play, and there's many, many more. Another one I can think of is anxiety reduction strategies, self-regulation, those types of things. Well, then you have to kind of take that information, you have to create your short-term objectives. And then what are your methods of evaluation? Well, basically, you're collecting data, right? You're also going to use observation and, again, daily behavioral sheets, whatever the case may be. You could even use a BASC if you wanted to for a little bit long-term type progress monitoring. And then remember that I mean, essentially, that's kind of, I think, how you start to think about how do I take all this information, but you always have to keep it in the educational context, not the behavioral therapy and mental health context, because you're not really treating depression. You're looking at the symptoms that the student experiences, and you're trying to help them gain more self-awareness and control so they can engage in the curriculum. And then naturally, we want to see also their behavioral scores increase as well. So it's just a little summary, because that was always the hardest for me, I think, as a school psychologist in the field.
All right, thank you, everyone. Welcome back for our final little stretch of PCRS. So before we went on break, Gina talked to us about various possibilities if a team feels like psychological counseling as a related service is needed. Now we're going to talk about goal setting and progress monitoring, and this is when we have determined that more intensive, either individualized or group counseling is warranted. We're not referring to if it is an SDI. So this is what we are talking about when we're considering goal setting and progress monitoring for PCRS. Next slide. Okay, so this is just saying that counseling can sometimes be a little nebulous at times, but goals can't. So like Scott referred to, we want to be specific in our goal. We want to consider the skills that we're addressing, the needs of the students when we're writing our goals. So if we want to go on to the next slide. So this is a problem-solving model that you could possibly utilize. So in the center, we see the collection and use of data, and we've talked about the collection and use of our assessment data as it leads us to the determination of student needs. So when you think about identifying a problem with precision, we want to answer several questions with our data. So we want to answer the questions of who, what, when, where, and why. So with our data, who is having the problem? What is the problem? When is it occurring? Where is it occurring? And why? And so really that hypothesis statement that you craft from your FBA should be able to answer that question for you. And remember, we're utilizing data in order to answer these questions and make this precision problem statement or hypothesis statement. Following that, we're going to identify a goal for change. So we'll identify how do we want the problem to change, etc. Following that, we identify a solution, and this is with your IEP team. So the IEP team has determined, remember, where we want the student to go, and now we're thinking about what do we need in order to get there. And that's where we might determine that we want to consider psychological counseling as a related service. We may consider individual counseling for that student. So once we develop a plan, we want to implement that solution with high integrity, including fidelity of implementation. We want to monitor impact of that solution and compare it against the goal. That's when we get to planning for progress monitoring. And Erica is going to talk to us about a plan for progress monitoring. And then finally, our IEP team will meet annually to make summative evaluation decisions. And also periodically, we might meet periodically throughout the life of that IEP to determine if we need to make changes for that student based on progress monitoring data. One of my favorite graphics. All right, next slide, please. So when we're considering those precision statements, remember, we are going to answer these questions, and we always want to make sure that we're basing the answers to these questions on the data that we've gathered through our assessment process. And like I said, you can usually, your FBA, your final FBA can really help you to answer these questions, including the use of the current level data. So when we're considering goals, and Scott started to talk to us about goals, We want to make sure that the goals that we are crafting are positively stated, that they pass what we call the dead man's test, and they are also realistic and attainable. So we want to make sure that when deciding the behavior to target while working with the learner, you want to make sure that, remember, we're operationally defining it so that any person who is interacting with the student understands what the targeted behavior is. We also want goals that are directly related to the skills that we are attempting to address, the skills that we are attempting to provide to the student in order to support them. And we want to make sure that the data that we are using to develop our goals is also going to be similar to the data that we're using to progress monitor our goal. We want to make sure that we are selecting goals, that we are choosing, remember, those behaviors that are related to school issues, that are going to result in the student being able to make educational progress on their goals. And we can also consider the social significance to those behaviors as well, if that is a need of the student. So next slide. So this is one of the resources that is available on the Padlet, and it is available from the National Center on Intensive Intervention. And it gives you an example of what does a quality IEP goal look like. So we want to make sure that the IEP goal contains critical components. So the time frame, so when will mastery be obtained? And it gives you an example of sample goal language. So by the end of the academic year, what is the assessment condition? So task, material, or tool, grade level, setting, or timing. So during social skills instruction would be an example of an assessment condition. We want to talk about the target behavior, and remember, observable, measurable behavior that anyone would be able to recognize as the behavior that we are attempting to change. So student will use a learned strategy to de-escalate. Student will appropriately ask for help, supports if needed. So independently with no more than 2 reminders when prompted. So you're going to consider if we need to include supports in our goal, the level of proficiency that we're looking for in accordance with the timeline. So from 50% accuracy to 80% accuracy. So we want to know what, by when, by how much, and then how are you going to measure it? And that's something we are going to spend the rest of this chunk of time talking about, the measurement or the progress monitoring. So it could be direct observation, direct behavior rating, it could be frequency counts. So we'll have to think about what is the best method of measurement in order to determine if a student is meeting their goal. And we want to delineate that within the goal. Okay. I believe you're up. No, one more slide for me. So when you're thinking about progress monitoring methods, these are some considerations. And Scott did mention that you could possibly use a behavior rating scale, but we do want to be cognizant that standard scores aren't always sensitive to change. It may not show that, even if a student's behavior is improving, it might not show up on that behavior rating scale. So if you were to use a behavior rating scale as a progress monitoring tool, it might be best to use it as a pre-post. This isn't something that you would be re-administering frequently. You could use behavior plans as progress monitoring. Behavior plans often have goals associated with them, but we definitely want to make sure we're really focused on our IEP goals and what's the best and most efficient way to monitor progress on that goal. Using direct observation methods of problem behaviors, that's one of the most robust methods to do it. But remember, we want to think about resources, time, skill level, etc. So if we're using direct observation methods, making sure that we have a plan for that, because we want it to be an efficient method of progress monitoring. You can consider direct behavior rating, which is a research-based method that involves teachers or staff members utilizing a brief rating scale in order to rate specific skills for a student. And Erica is going to talk to us more explicitly about direct behavior rating. And we just want to make sure that we are linking that method of progress monitoring directly to the goal. So we don't want to say we're monitoring our goal in a specific way on the IEP, and then in actuality, we're choosing a different progress monitoring method. We need that both of those to align. So Erica is going to take over, and she's going to give us an overview of direct behavior rating.
Yeah, so thank you, Shonda. I think those are all good points. There are a lot of different ways that we can measure progress and monitor progress. When we think about monitoring behavioral progress, it is a little bit different than when we monitor academic progress. So for example, we have tools out there that let us know at the end of second grade, students should be reading 90 words approximately correct per minute on an oral reading fluency measure to be on track. But behavior can be a little bit different from that. So it really is very dependent upon the context, upon the environment, upon how it is interfering with the students' access to their educational programming. So there are a variety of measures out there. Behavior rating scales, very standardized, but they aren't as sensitive to immediate change. So we're going to talk a little bit more in depth about one of my very favorite tools called direct behavior rating. So direct behavior rating, as Shonda talked about, is a very brief and easy tool to use, and it's great for progress monitoring because of some of the properties of it. And one of the last sessions that we had live last year, I'm not sure, I hope some of you were able to make it, was Dr. Sandy Shafolius out of University of Connecticut, who's one of the principal researchers on direct behavior rating. I did place on the Padlet for everyone some DBR resources. You can check out a patent pod that features Dr. Shafolius, kind of giving an overview of DBR, of direct behavior rating, as well as the website. So these tools are free, they are validated, and as you'll see, they have a lot of nice properties to them to help us really effectively and efficiently progress monitor behavior. So we often, when we think about in a multi-tiered system of support, and as we think about psychological counseling as a related service, these are often the students with some of the most intensive behavioral needs. So direct behavior rating can be utilized at all tiers, but we really need to be able to have evidence-based interventions at all tiers. And as we think about counseling interventions, we want to be selecting things that we know are going to work. We also want to be able to quickly evaluate, as quickly as we can, what are those effects across a range of behavior issues. So we need our behavior progress monitoring tools to have some flexibility. We want to think about having data available to inform decisions, and this needs to be available efficiently for us to be able to collect and interpret those data. So as we talk about behavioral rating scales, they're great. They give us some standardized scores, some percentile ranks. They're not always efficient, and they're not always very quick to inform decisions or responsive to daily changes in students' behavior. So it's helpful to have some ongoing streams, some ongoing data streams to inform decisions. We want to be able to systematically and consistently collect behavioral data on a repeatable basis. And finally, it's important for us, and especially as we think about collecting progress monitoring data for inclusion in students' IEPs, we want those data to be defensible. So that's why we chose to go in a little bit more depth today about DBR specifically. It's something not a lot of people use, and we hope that this will encourage you to check it out maybe for use in your practice. So as Shauna talked about, what is direct behavior rating? It's a tool that involves a very brief rating of a target behavior following a specified observation period. So a class activity, so we can be very targeted for the classes and settings that we want to collect data. And it is completed by the individuals who are naturally occurring in that context of interest. So the direct behavior rating, some of these things may look familiar from other tools that you may have used or read about in your experience. So it really is a way to systematize behavioral progress monitoring, and it's built upon some of these other tools, things like behavior report card. It really is a way to systemize communication about behavior, to help progress monitor, to help inform our goals, to help inform our intervention efforts. But some other things you may have heard: homeschool notes, daily progress reports, etc. But this brief rating is completed in that environment by the persons who are naturally in that context of interest. So when I talk about that, many of us on, and I know we have a wide variety of school mental health professionals on, this is something that we can utilize across our different disciplines, but some of us may be very used to going into a classroom and collecting some observation data. Maybe we're doing a practice called systematic direct observation, where we go in and we're looking for certain behaviors at certain intervals, and we spend 30 minutes in a classroom observing. Direct behavior rating would be maybe the classroom teacher, perhaps a paraeducator who was in that setting naturally collecting the data. And one of the things that has been found in the research with direct behavior rating in comparison to a systematic direct observation is those ratings are pretty consistent with what you would get for SDO. So when a teacher or maybe a paraeducator has had a little bit of training on how to do this, their ratings would be pretty consistent with what we would get in SDO. So you can see how that can be pretty efficient. And I'll talk about a little bit more what that looks like, but it doesn't take much time. So we might want to think first, how do I use the DBR scale? How do I use direct behavior rating? First, you want to determine the behavior of interest. So there is another worksheet, direct behavior targets worksheet, that might help you with that. But when you think about developing your precision statement, as Shonda mentioned, when we're developing that precision statement to inform our goals, when we're using this in a PCRS context, we have those behaviors of interest already operationally defined. Hopefully, what's our rationale for targeting that behavior? We want to decide on the scale format. I'll show you what's called a single item scale. You could look at multiple behaviors. We want to think about the observation period of interest. So we've hopefully operationalized that through our precision statement and through our goal, thinking about those, those big five questions that we want to ask as we develop a precision statement. But where and when, what is that observation period of interest? Do we want to observe during math class? Do we want to observe during math and science? When might that occur? Who is the rater? Often in the educational context, that might be the classroom teacher. It could be a paraeducator. Perhaps, maybe it's the speech and language pathologist, just dependent upon the behavior of interest that we want to collect data on. We need to provide a little bit of rater training. It's pretty easy to do. This is a tool that I used in practice as a school psychologist. Folks found it very easy to use, and they often preferred this significantly over other tools that I gave them, such as like a BASC, for example, some of those rating scales that are like 80, 100 items. So we want to provide a little bit of training. And then finally, we want to make sure that the materials to collect DBR data are accessible, that the individuals who need those are able to access those. So you just have to kind of think through your checklist. So here is the standard behavior form, and these were already developed by, I just want to take a minute to show you this, but these are 3 behaviors that you can kind of think of as a general outcome measure for behavior. So when students are engaging in these behaviors, they're pretty well set on a path to be able to appropriately engage in the learning activities in the classroom. So you can see the behaviors are operationally defined. And if you go on the DBR website and get the 3 standard behaviors, this is a great tool to utilize. These are often things that are biggest concerns for teachers. And when students are engaging in the behaviors, then they are more likely to be participating in instruction, the good instruction that's happening. So we have academically engaged, and as you can see, we're selecting the date, when's our observation start and end time, who's the student, who's the rater, brief description of the activity. So maybe it's math fluency practice whole group. So we're looking at the student of interest, and we're looking across the percent of time that they're engaged in that behavior. So again, a teacher who has had a student for approximately 4 weeks in class is going to be able to do this pretty well. If if a teacher's only had a student a day or 2, their ratings aren't going to be as valid as someone who has had a student for about 4 weeks. So at the end of that predetermined observation time, so let's say we decided we're looking at whole class math fluency practice from 9 o'clock to 9:20. That's our observation time. Immediately at the end of that observation time, the teacher would draw a slash on each of these behaviors as to how much of the percent of total class time, they're just taking their best estimate, the student was doing that operationally defined behavior. So academically engaged is defined as actively or passively participating in the classroom activity. And you might recognize some of this language for those of you who do some systematic direct observation. So, and then there are some concrete examples: writing, raising hand, answering a question, etc. Respectful is defined as compliant and polite behavior in response to adult direction or interaction with peers and adults. So then there are some concrete examples of what that may look like: following teacher directions, pro-social interaction with peers, positive response to adult requests, etc. And then disruptive, now that one is kind of reverse scored. We know that when students are non-disruptive, then they're more likely to be academically engaged. But it's easier to measure disruptive behavior. So again, we don't want a higher rating on disruptive when we're setting our goals. We want to reduce that. But disruption is operationally defined is student action that interrupts regular school or classroom activity. So there are some examples on here: out of seat fidgeting, playing with objects. But these are kind of the big 3 that teachers will often select as behaviors that we either want to increase, the academic engagement and respectful behaviors, or decreasing disruptive behaviors. But you can see from the form that it really is a blend of systematic direct observation, where we as a school psychologist or school counselor or school social worker may go into a classroom for 30 minutes, observe a behavior, however we're tallying up our results, and then using that information kind of as a baseline or progress monitoring, or to help inform the assessment process. Whereas DBR, it also follows that same guideline. It's done at a specific time, and the teacher needs to do the ratings immediately when that time period is over. So it really is a blend of systematic direct observation and a behavior rating scale. But some of our typical behavior rating scales ask us, think about the student's behavior over the past month. This is very time bound. This is very immediate. So you can see how it's very efficient, flexible, and it gives us some good information about behavior from day to day. So this is the standard behavior form. So again, I talked about this briefly, but we want to think about that observation period of interest. When do we want to observe those behaviors? So, is it general classroom behavior during the morning block versus maybe progress monitoring of transition time behavior? So there's a lot of flexibility depending upon your goal for the student. When we think about psych counseling as a related service, we can be very flexible as to when we use DBR. We want to make sure that the same rater completes all ratings for the pre-identified observation period. So for example, if we want to observe during reading and we're having the primary teacher for that, what we don't want to do is have a different person doing it each day. We want to keep that person consistent for that time period, for that pre-identified observation period. And again, the rater needs to be ready to record ratings as soon as possible following that pre-identified observation period. So when I use this in practice, teachers would often say, Erica, this was so easy to do. It literally takes me like 5 seconds to draw a slash on the behavior 2 or 3 that I was to be rating for this student. So when we think about making tools and resources, teachers have a ton on their plate. This can give us some great data and not be a heavy lift or a heavy burden on teachers' time. And just another point, remember whenever we're doing the rating, each behavior is considered independent of the other targets. So they don't have to equal 100%. So a student might be engaged 50% of the time and disruptive. A student might also be engaged 100% of the time and disruptive for 10%. Maybe they're engaged the whole class, but they're making some off-task comments during instruction. So it does not have to add up to 100%. So as we go across, it doesn't have to be like 40, 40, and 20. Each behavior is considered independently of the other targets. So again, we take the DBR instrumentation and procedures checklist. We think about how might we potentially use DBR, and we want to hypothesize our procedures for implementation. So here's another example of a single item scale and how we might interpret that. There's an example that we may use for older students, and then we have an example for our younger students. So you simply just place a slash or a dot marking along the line that reflects the percent of total time for that observation period. So your observation period is flexible. It could be 20 minutes, it could be 40 minutes, it could be, a 60-minute block. Whatever that predetermined time is, at the end of that time, the teacher or the predetermined rater just makes a slash to indicate how much of that time period the student displayed academically engaged behavior. So we would interpret this as the student displayed academically engaged behavior during 80% of large group math instruction today. We could also do it on a 10-point scale and draw a circle around the number that corresponds with the percent of time. So here might be for younger students, circle the number that best represents the student's attention during circle time. The student received a 6 for attention during group circle time activities today. So there are different blank formats on the DBR website, but ratings should indicate how much that the student did the behavior. So another way to kind of anchor your rating if you're using the 10-point scale instead of percentages is low, medium, and high, with an anchor of 0 is never, 5 sometimes, 10 always. So again, this is pretty easy to use. You can add some additional qualifiers in here. 1 to 2 is occasionally, 3 to 4 is a little less than half the time. 6 to 7 is a little more than half the time. 8 to 9 is very frequently. So you can see it's pretty easy to set up. and it's pretty easy to collect data. So before you begin rating, you want to pay attention to the behavior and the scale. And I mentioned this in the 3 big behaviors. So for example, a lower score on disruptive shows better behavior, right? We want decreased disruptions because when students are not engaging in disruptive behaviors, they're typically better able to be academically engaged. Whereas a higher score on academic engagement shows better or indicates better behavior. So just keep in mind, some of those scales might be reverse scored when we're thinking about goals and thinking about behavioral gains and improvement when we think about our goals. So I did place on the Padlet for you from the National Center on Intensive Intervention, there is a DBR graphing template. And as we know, we want to move away from those as needed or will improve. We want to move away from those nebulous and unclear goals. We really want to have strong operationally defined goals. And as we monitor progress, that's how we can determine are students meeting those goals. So charting progress is a great way to help us see how the student is progressing, how to communicate that in progress reports to parents, to the IEP team. So this is an example of pencil throwing, and you can download that template. You can change the target behavior. You would have your target behavior. You would want to put an operational definition. As Shonda talked about earlier in our session, what does that behavior look like? If I walked into the room, how would I know what I'm looking for? You can have some concrete examples, some non-examples, and you can think about your anchors for that. What are your dates? What are your DBR? So this one using the 10-point scale instead of percentage of time. But that's a great way and an easy way to collect some data. So again, as you can see here, how we look at progress monitoring from DBR. But it is a great tool. One of the guidelines from the research is we need at least 6 to 10 data points to get a good picture of what's happening. So we don't want to make decisions on fewer than 6 to 10 data points. So we're thinking about, is the intervention working? If we have 2 data points, we don't want to make decisions on that. We want to give an opportunity to collect 6 to 10 data points, and ideally collecting those daily in that predetermined period of interest. And you may collect across multiple periods. You may have multiple graphs, just depending on the complexity of the behaviors that for which you set goals and for which you would like to collect progress monitoring data. So again, graphing the progress helps us see. You can put, I don't have my annotate on, but you can put a line to indicate what the goal is, just to add some extra elements of showing that progress or lack thereof that the student is making. So I talked a little bit about DBR. We also have to consider, as Dr. Hunter talked about yesterday, we also have to look at the impact on students' academic performance. And we want to be able to do some progress monitoring for academics as well. And especially some of those behaviors are really intricately connected. We had examples from the chat earlier, shutting down behavior. If part of that function of shutting down behavior is maybe there's an instructional mismatch, for example, we want to be able to have academic progress monitoring data to help see, are the behaviors improving, and are we having improvements in behavioral data? But we would hope that as students improve behaviorally, they would also make improvements academically. So thinking about pillars 1, 2, and 3 about our practice model as school psychologists, and I know that our colleagues who are school counselors, school social workers can relate to some of this as well. So when we think about administering assessments, curriculum-based measurement, curriculum-based assessment, Do we have some general outcome measures that can help us see our students meeting those goals? How are they doing on a general outcome measure? How about sub-skill measures? Mastery measures are great for math. Do we have norm referenced assessments where, maybe we've done a pre and post on a standardized achievement test, for example? What are present levels that we may be seeing with students' academic achievement? How about ongoing progress monitoring and summative assessment? Maybe they are working on a reading goal as well. And so we're measuring oral reading fluency, and looking at words read correctly per minute, for example. We also want to consider obtaining an interpretation of assessment results. So how might we be assisting teams with interpreting diagnostic assessments? How might we as school psychologists be assisting teams with interpreting progress monitoring data? Some interesting things to do might be to look at behavioral progress monitoring data along with academic progress monitoring data, seeing if there are any trends there. We want to make sure we're matching student data to interventions and specially designed instruction. It's important to consider the instructional hierarchy. So for those of you, I'm also on the math team. This is something we often talk about. Instructional match is very critical, not only in math, in reading, as well as behavior. And learning kind of follows a hierarchy, where when we're in an acquisition phase, we're kind of slow and inaccurate. So what we need to be able to do at that point of learning is provide explicit modeling, immediate corrective feedback. There's a lot of teacher direction at that level. So if students are just learning a new behavior, for example, this is where there's explicit teaching of what that correct behavior looks like. There's immediate feedback. There's a lot of reinforcement. So as students start to get accurate with that, we need to help them be proficient in using that behavior, build fluency, just like we would help them build fluency with math computation skills, for example. Math, we can think of it in the same way. As students are learning a new concept, we're using concrete modeling, maybe we're using manipulatives, we're using a lot of guided practice, teacher direction, immediate corrective feedback. Then as we move to building fluency, we're building in more opportunities to respond. We're delaying that feedback a little bit. So this is where students get a chance to practice. So this may be where they're practicing in a small group. But that instructional match at this point in time, as students are ready to build fluency, more opportunities to respond, feedback is delayed. And then finally, what we hope as the students generalize those skills. So whether it's math, they're able to generalize computation skills to word problems. When it's learning a new behavior, now the student is generalizing those skills outside of our small group session, and they're generalizing those in the lunchroom, for example. So it really is important to get that looking at student data, matching that to the interventions that we're providing. Do they need an acquisition type intervention, or do they need to build some fluency and proficiency with that skill, so that ultimately we can help them generalize that skill to other settings. So just considering the instructional hierarchy. Then finally, as we think about, how can we support teams progress monitoring for academics? When we think about integrating assessment results, how can we help teams integrate data for present level summaries in IEPs and evaluation reports and reevaluation reports? How can we assist teams with writing goals? And then also thinking about how do we assist the teams with educational decisions regarding least restrictive environment and least restrictive level of support. So we don't want to totally take academics out of this. As we know, behavior and academics in the school setting often go hand in hand and are intricately related. So we really do have to take into consideration how those have an impact on the student's performance. So Talking about progress monitoring, so we've kind of talked about, why do you cite counseling as a related service, determining the need. What does that continuum of services look like? How might we set goals? How might we develop a precision statement? How do we set goals, and how do we monitor progress? One of the areas where things tend to fall apart is in implementation fidelity. So we may have the best of intentions, and people will often say, you know what, that didn't work. It's not working. We may not have given it enough time. We may not have implemented it in the manner in which it is meant to be implemented and to get those desired outcomes. So there are a couple different ways we really want to make sure that as part of the process, we're doing some type of fidelity check on implementation. So this may include documenting the times met with the student and staff. I'm sure all of you who are mental health providers in the school have great documentation systems. So if you're meeting with staff to provide consultation, make sure you're documenting that. What are the times that you met with the student? Make sure that you're documenting that. Document and provide documentation of the intervention or the procedures used. So maybe you're using a modular approach to cognitive behavioral therapy where it's not a scripted protocol, but rather you're taking some specific pieces of that. So document specifically the intervention that's being provided, as well as the procedures being used. Some of the tools, especially when we think about manualized programs, might have a fidelity checklist. And that's just a list of all of those active ingredients that you need to have to make sure that that intervention is being provided in the manner intended. And it just helps us give feedback. As we know, even people who have been implementing things, whether it's school-wide positive behavior support on a systems level, or whether we're using something like a coping cat, where it's a very scripted CBT intervention, we have a little bit of drift in our implementation practices. So measuring fidelity of implementation is just helpful to get us centered back where we need to be. We think about session notes. So, keeping notes on our sessions with students, maybe with families, with parents, with regard to student educational need, but keeping documentation. Essentially, are we doing what we said we would do in the manner intended? And then finally, you can use DBR to progress monitor your fidelity. You can do a DBR fidelity rating. So I'll talk a little bit more here about service delivery. I kind of highlighted all these already, but documenting with the student and with the family when applicable, because remember, PCRS, dependent upon the identified need, can also include the family. Thinking about meeting with staff during consultation. How long did those meetings last? What was the purpose of that meeting? What was the function of that meeting? Thinking about intervention procedures. What specifically did we use? The modular approach to CBT, maybe activity scheduling to help the student make connections between how they're feeling and the scheduling of pleasant activities. If you haven't done that, that's kind of a neat activity. Thinking about fidelity checklists, essentially it is a task analysis of every step needed to implement that specific intervention as intended. It's kind of like, so I think about Pinterest. Pinterest isn't good for research, but it is good to help find recipes, also some fashion and things like that, and like how to, I don't know, design your back deck outside. But I think about Pinterest and some of those Pinterest fails. So you want to be following all of those steps to be able to create that beautiful Easter cake. But if you miss some of those steps in that task analysis, you kind of have a scary looking cake when you're done. So think about your fidelity checklist as that task analysis to document the steps needed. Is there an implementation checklist already developed for you? So some standard protocol interventions might have that checklist you can pull out and use, but if not, you're just simply doing a task analysis from beginning to completion as to how to implement that intervention as intended. Our session notes provide qualitative information regarding that service delivery, as well as the student's response to that delivery. And as I mentioned, a very easy way to do it. You know what? You could even use DBR to evaluate your implementation of what intervention or action you were going to do. So you can make it really easy. We agreed to whatever that plan is. Are we implementing the plan? And you can put a DBR scale, a 0 to 10 or a 0% to 10%. Very easy. But this can help you problem solve, using the percent absolute value rating scale as a metric, make it really easy to gather and start simple. So that's one of my favorites. Okay,
Erica, we have a couple of questions.
All right, I was gonna pause before we get to intervention intensification. So yes.
Okay, so the first question is, how can you modify a goal or make it more challenging without starting over with a new graph? So I think she was referring to the DBR scales.
So how can you modify
a goal or make it more challenging without starting over with a new graph?
So I think two things come to mind. Number one, if the student's meeting that goal, do we need to make a more challenging goal? Or, as Shonda mentioned before, should counseling services be a life sentence? So you're still working on the same goal. You could move the goal line, for example. You can still plot, you're still going on that 0 to 10 scale or 0% to 100%. So you could move the goal line. Maybe you're starting with 70% and you're moving it to 90%. You could add in phases as well and just document, maybe there's a phase change for some reason that goal is being intensified.
Okay. And then there was another question. Do you have any suggestions on how to use these types of DBR scales in a virtual environment when students are not mandated to have their cameras on?
So it would be really tough to utilize a DBR in a virtual environment when students aren't mandated to have cameras on. Dr. Hunter and I did a session. Let me make myself a note. One of the things you could do, and when I talked about DBR and its history, those things like homeschool notes, it's a way to communicate about behavior in a systematized way. So one of the things that we talked about supporting behavior in remote learning settings is you could partner with the family. It would be very easy to train a family member to do DBR. And something else I didn't mention, dependent upon the age of the student, students can also do their own DBR and maybe compare it with the parent or the teacher. Now, what I would say would be difficult for the teacher to do the DBR when we have a class of 20 and kids' cameras are off. That would be really tough. I think that would compromise any reliability or validity to that. I think DBR could be done if it's a smaller group and teachers can see, the students on Zoom with their cameras on. I think the teacher would be able to, again, you'd have to operationally define what the target behavior looks like in that context of online learning. But workarounds would be working with families and caregivers to complete that at home, working with students to complete that at home.
Thank you. Those were the only two questions we had.
Okay, awesome. So we'll continue on, and thank you. Those are some great questions. I do encourage everyone to check out the DBR website. Check out the patent pod on there from Dr. Shafoulias, one of the primary researchers on it, if you'd like to learn more, but it really is a great tool. And I will remind me, let me write it down, I'm sorry. Video, I'll post the video that Dr. Hunter and I made earlier this year about behavior in remote settings, where we talk about that. Okay, so this is often where we want to think about, what do we do when our intervention isn't working? And again, sometimes we don't give enough time for the intervention to take effect. I think especially about challenging behavior, and I'm sure I know there are so many colleagues on this call that feel the same way and have the same experiences. People want to see immediate change with behavior, and it takes a little while when you're thinking about those stages of learning. We're going from acquiring a new skill, then we need to get proficient at doing that skill, and then we need to be able to generalize it, where we might put a behavior intervention in place and 2 or 3 days later, the teacher is asking, hey, this isn't working, we need to do something else. So we really want to think about the other aspects of that. Did we match the intervention to the student's level of skill development? Is it age appropriate? Have we progress monitored? Have we collected enough data on that? So if we're using something like a DBR, do we have at least 6 to 10 data points? 10's a little better, to kind of validate that it in fact is not working. And have we looked at fidelity? Things might fall apart if we're missing some of those active ingredients that help make that intervention most effective. So what do we do when our intervention isn't working? One of the tools on the Padlet is through the Intensive Intervention, National Center on Intensive Intervention, intensiveintervention.org, but data-based individualization. And so it really is a multi-part process. So this graphic provides kind of an overview of how that works. So we're starting with, we're thinking about data-based individualization as a research-based process for individualizing and intensifying interventions through the systematic use of assessment data. We're using interventions that have been validated and research-based adaptation strategies. So when we think about our steps, our first step is we want to implement that current validated intervention program. Is it a tier 2 standard protocol? And this doesn't just apply to behavior, this also applies to academics. So this data-based individualization model has multiple applications to it. So we want to think, are we implementing that as intended? We want to then be able to collect frequent progress monitoring data. One of the tools on National Center of Intensive Intervention is direct behavior rating. That is a very helpful progress monitoring tool for behavior. So we want to collect frequent progress monitoring behavior or progress monitoring data for behavior. And we want to determine, is the student being responsive to that, or is the student not being responsive? If they're continuing to have difficulty, this is where we might do some diagnostic academic assessment or functional assessment. As Shonda talked about, functional behavioral assessment might be where we look. If students have co-occurring significant academic difficulties, sometimes really need to intervene with both, and we may need to dig a little bit deeper with regard to academic skills. Then we want to think, okay, so we're using that diagnostic data to help us make adaptations to the intervention being provided. So educator expertise can also assist us in helping determine contextual fit for how we might make some adaptations to that intervention. And then we want to continue collecting progress monitoring data along the way at regular intervals to determine responsiveness. and help make additional adaptations as needed. So it really is a process to follow. And when we think about progress monitoring, one of the reasons why we pulled direct behavior rating is because it is really quickly responsive to what is happening on a day-to-day basis versus something like a behavior rating scale, for example, with standard scores, that might be part of this portion of that. Those can't be administered every day. They're not always as responsive to immediate changes in behavior on a day-to-day basis. But data-based individualization is a helpful way for us to start to drill down and look a little bit deeper whenever interventions aren't having the desired effect. So we also want to think about how well does this intervention work for students with the most intensive needs? What is the strength of this intervention? So you can look at things like effect size, for example, a stronger effect size, and who was the population for which this intervention was designed, and what population was included in the research for this. Does it work well for students with the most intensive needs? So we're thinking about strength. We can also think about dosage. So dosage can be thought of in a number of different ways. Are there adequate numbers of opportunities to respond? When we think about stages of learning and students are in an acquisition phase, it's more teacher directed, more direct and explicit modeling, a lot of opportunities for immediate feedback. But as students need to build proficiency with using this skill, are they getting enough numbers or enough opportunities to respond so that they are fluent and proficient with this skill? So that is something to consider in our dosage. Do the students have enough opportunities to receive corrective feedback? So that's important, especially when our students are making errors. They need that opportunity to get corrective feedback so that they can perform the replacement behavior that we're hoping to improve, or the replacement behavior that we're hoping that the student will utilize more frequently. What's the group size? What's the length of the session? What's the frequency of the session? Just depending, I would look at the research and determine in the National Center on Intensive Intervention, you can compare different interventions. It's kind of like a consumer reports for assessments for interventions. But was that intervention designed to be delivered once a week, or was it designed to be delivered in a session every single day of the week? Was it designed to be a 20-minute session, or was it designed to be 40 minutes? Should it be provided in a group of 3 or less, or a group of 5 to 10? What does that dosage look like? But these are some questions you can go through as a team and consider. And each intervention, just dependent upon the research, may have different dosages that need to be followed. So how well does the intervention align and address the student's full set of deficits? How does it not address skills the student has already mastered? So this kind of seems, how does it not address skills that the student has already mastered? So if the student has already mastered some skills and we're giving them an intervention that is helping them acquire, we're doing explicit, direct, providing explicit and direct instruction with frequent feedback on skills that a student has already mastered, that's not going to help them grow. So we need to make sure that we're getting at that right spot where it is targeting skills that they need to master. And is the intervention meaningfully focused on age-appropriate skills for that student? So these are all important things for the team to consider, and for you as a school psych, school counselor, school social worker, to help the team stay focused on. It's also important to think about attention to transfer. So sometimes we'll often hear, and I'm sure many of you have heard this, or you've worked with students and they do well in your group, or you might get input from the special education teacher, the student's case manager. He does this in the emotional support classroom, but then he doesn't generalize the skill to other areas. So we want to make sure that the intervention is helping students explicitly generalize those skills to other areas, because ideally, we want them to have that skill across a broad range of settings so that they can utilize that. We also want to think about comprehensiveness. So how well, when we're providing the most intensive interventions, does it have opportunities for modeling? We don't want to make assumptions. We want to be able to explicitly model what that looks like. How does it have examples and non-examples? And I'm sure many of you are on PBIS teams at your school. When we teach behaviors and PBIS lesson plans of positive behavior interventions and supports, or school-wide positive behavior interventions and supports, we show examples of what that correct behavior looks like, and we explicitly teach and reinforce those. We also want to include some non-examples of the behavior, but we don't want to pick things that are really wild. So for example, if the behavior is working quietly at your desk during independent practice, and we want to show some non-examples, we pick those ones that are kind of common, maybe a student playing, in their desk instead of doing their work. What are some non-examples? Or a student out of their seat sharpening their pencil. We don't want to be real wild with the non-examples and like show a student standing on their desk and doing a backflip off of it. That's too extreme, but we want to pick those most common behavioral errors that students might do instead of the example behavior, or the correct behavior, the desired behavior that we want to see. We also have to make sure, as we think about intensifying our interventions, that students have the necessary background knowledge about that behavior. We may sometimes have to back map a little bit and find some more foundational skills and intervene there. We want to give that gradual release. Again, as a student is new at learning a skill, a lot of modeling, a lot of immediate feedback. I do, we do, you do, supporting that student. And then we kind of gradually release them to give them some more opportunities to respond and show that desired behavioral response. So it is a gradual release process. We also want to help provide the student with sufficient opportunities for practice. And this is something that's often missed. So we might have a lesson or an example, and we're showing them how to do this. They might show us a time or two that they can do it accurately, and then we think they're good, but they may not have had enough opportunities for practice. So they're not fluent with that behavior, and then they're not ready to generalize it to other settings. And then we also want to consider cumulative review. We want to go back and make sure, help students practice some of those previously learned behaviors here and there, just to keep that skill set fresh. So we want to make sure that we are comprehensive in intensifying our interventions. Now, as we've talked about, our progress monitoring data, we need to know when to terminate services. And whenever we develop those precision statements with a goal that has all those right elements, who, what, when, where, why, we know the data whenever the team has agreed the student would be successful with that, then we have to be able to terminate services. So keeping in mind, counseling is very helpful, but it should not be a life sentence. And some of those vague goals, like he will improve his social skills. With a goal like that, you could be in receiving services, throughout your entire educational career with no real progress or knowing when you've met that goal or not. We want to evaluate multiple data sources. So we can think about measurement in sessions, thinking about how are we measuring student behavior in the natural setting. And again, that's one of the reasons why we brought direct behavior rating as a good chunk for this, because that's a great tool to help measure students in the natural setting to see, are they generalizing those behaviors that maybe we provided in an intervention to the settings where they need to show those. And then finally, has the student had time to focus on generalization of that behavior? So those are all important things. We hope that those are helpful for you as school mental health professionals supporting psych counseling as a related service. So I'm going to see if there's any questions, and then we'll turn it over to Scott.
Erica, we did have one question that really aligned to what you were just talking about on the last slide. So the question is, do you have any recommendations to support generalization of skills in a school environment? And what are some ways to fade direct support to help students utilize these skills within the classroom?
So I think because behavior doesn't have, it is defined by the IEP team. So I think, it definitely is context dependent. So that's where your goal setting is going to be really important. When do you know that the student has reached a success criterion for that particular behavior? So it just depends upon the behavior and at what level. Thinking about typically developing peers. The other thing sometimes that happens is we might look at goals and we're doing a good job setting data and goals, and then our goal might not be realistic for that student's developmental age or peer group. So I think looking to what might be typical for peers might help us set goals for generalization. Again, it's not always perfection, and it depends upon the behaviors that we are targeting. Counseling services should be targeted, towards specific behaviors that the team has identified that are interfering with a student's educational process. So there's not a one size fits all answer. Any other thoughts from the rest of the team on that?
I agree that you're considering that criterion, and you can address generalization as you're writing the goal. And if you're writing supported objectives within that goal as well, and you can address fading and generalization in that way as well. There's another question that just popped up. So if individual service seems to be showing gains towards goals and progress monitoring, but generalization does not appear to be improving, do you have ideas about changing service or delivery model? And I think that would have to be an IEP team decision. So if you're going to be changing service or delivery model, that would be an IEP team decision.
Yeah, I would agree. It definitely needs to be an IEP team decision. And then, we think again of going back to the assessment process. How are we determining that? How are we determining what service? When we think about, adding related services, probably we want to go to best practice and opening up, the reevaluation process when we're determining eligibility and need for special education and related services.
Yeah, and really think about it the same way as if you had OT or PT and they were considering doing similar things, changing the service delivery model, generalization, et cetera. So you can consider how are those individuals operating, and that can help support thinking about how would it apply within the context of individual counseling.
Okay.
All right, thanks.
Okay, thank you. So I'm going to turn it over to Scott, who is going to close us out and talk about how we can partner with our community service providers.
Thank you, Erica. Very, very nice. Thank you very much. I'm going to take us home through the last probably several slides before the end of the presentation. And I'm sure many of us, whether you work in a school district, or you work for an intermediate unit, another kind of an agency through private school, you've always worked extremely hard when you're working with your students that have those advanced emotional needs to partner with your community agencies. Oftentimes they can be our lifeline in schools, and we very much value their input and their expertise. So it's definitely another consideration when you think of psychological counseling is related service. Next slide, please. One of the things then that we talk about and that we want to kind of drive home is the idea of intra-agency collaboration, establishing those working relationships. The overall goal then would be to have a seamless system of care for that student on an IEP. I often found it very helpful, when you work with students in providing psychological counseling as a related service, the importance of, let's say if you're working on anxiety reduction strategies with a particular student. Well, it would be nice if you knew that if that student was receiving mental health services or perhaps services of a behavioral specialist consultant, a BSC, that you might want to see what types of strategies they're working on with the students to make sure that your strategies don't conflict with the outside providers, just for consistency of communication. So again, it really involves a close working relationships among schools, as I said, intermediate units, the student, as well as other agencies, to really make sure that you have a seamless system of care in place that's concise and accurate for that particular goal that you're trying to achieve through your psychological counseling as related service. Also, it just establishes the importance of good communications with the outside agencies, the outside providers, having an understanding of an awareness of the services that they provide, what their process is, if they have follow-up opportunities, who do you need to contact? It's good to have that information in mind when you're trying to communicate with providers. Next slide. Now, when we think about outside agencies, here's kind of a short list, but again, it's not limited to just these. Some of the departments that you work with in the past, you might think of as the Department of Human Services caseworkers. You may have worked with people from the Children's Bureau in your area. When you think about vocational rehabilitation counselors, OVR comes to mind. When you think of social services and social welfare agencies for mental health providers, you might think of the times you work with a therapeutic staff support person or a TSS. Again, the BSC, as we mentioned, or maybe mobile therapists. Also, you work very closely in your profession with other medical professionals that help support the student, as well as through your base service units, your mental health providers in your regions or in your areas. Next slide. Also, sometimes it's nice to make sure that as a part of the process, that perhaps somebody is identified as an intra-agency liaison. Now, this person could be identified to help coordinate interaction, enhance public awareness of the services available to the students, also provide information to the families and the schools, and help facilitate referrals. Also, they can actually help you expedite services that you need to provide to the students. Sometimes if some of you work in community-based settings where you're providing services as a continuum of service to your school districts, you often find times that you have students that have some pretty significant needs. In turn, there may be times when you need to have a person in your building that is designated as that particular liaison to communicate with the outside agencies. Oftentimes things that come to mind would be, there are times, unfortunately, if you want to make sure that the students are working through the services from the outside providers, you may find a time when if the student is not in control of their behavior and there's been a number of restraints in time, a point person you can contact from the outside, mobile therapist, the BSC, to come into the school to help support you in the process of implementing the program that you have in place for the student. Next slide, please. Also, when you think of communication with outside agencies, here are some tenets that always to keep in mind that you should kind of work towards. You want to make sure that you establish a structure or process for working together. establish the parameters for the relationship, also to establish a process agreed upon for group sharing and problem solving. Sometimes the information that you provide in-house is confidential. The information that they have in their setting is confidential. Agree ahead of time on what type of information you both feel comfortable sharing at that particular time. Because again, we're really trying to support the student the best we can with a seamless system of care from emotional support services for the student. Also consider procedures from input from the parents. Have them participate in the process of establishing the goals for psychological counseling as a related service. Include them at the very beginning of the process. See what their insights are. And as you know, many times we work with our parents very hard and they have lots of information to share, especially with the application of the skills that we're teaching when they go home in the home environment. So they're all important things to keep in mind. Also establish meaningful and effective communication before the fact among the personnel and the agencies that work with the given student, kind of the information that I had just shared. But again, it's just really critical to include the outside providers as team members to help share information that they collect on the student outside of the school setting. Next slide. Also, when we think of psychological counseling as a related service, also in IDEA, it also indicates that we should be assisting our parents in understanding the special needs of the child. We should also be providing with the parent information about child development. We should be helping our parents acquire the necessary skills to support the implementation of the child's IEP goals at home. We're not necessarily providing counseling to the parent, but we're providing them with information and strategies that they can use to help increase our success rate in the school setting and transferring of those skills we're trying to teach to that student. So it becomes more automatically for the student.